This is part 2 of talking about your liver, because the liver we've seen stagnated in a lot of people. I personally had my own struggles and I had a lot of liver pain, and I know how to treat my liver, but I thought, how can I teach you guys how to do it yourself? And then one day when I didn't have her to treat me, I found this little tool and I started rubbing it in different areas, and I found that I released my liver. So we're going to show you right now. So the first part you're going to do is you're going to release your right lymphatic duct. This is where all the lymph drains from the right side of your body, and it seems to be where everyone gets stuck when they have the liver as a big problem. So first we're going to open up there. So you can use this with just about a pound of pressure, but don't hurt yourself. Just see what feels like enough pressure that you feel like it's making a difference, but not hurting yourself. Next, we're gonna do the top here, kind of like the trap area. This is a huge one. If we can get this open, a lot of people feel a lot of relief. I want you to listen for gurgles in your liver. Your liver, remember, is under your right rib. And you can work all the way up the neck. This is the referral points for the liver and gallbladder. She's just rubbing that up the back of her neck. You can find where it's tender, and then up into the scalp where I showed other referral points in the last video. Other points that get stuck is the biceps on the right. So again, find a tender spot. If you're having liver problems, you might have aches in there as well, and work that area. The next, you're gonna go to your tricep, and you're just gonna poke and rub that along there. So find the tender spots and then kind of rub it on the tight areas and down into the back of the shoulder, because this is where you're going to clear a lot as well. The back of your shoulder is a place where it can get stuck as well. So all in here, it's called the quadrangular space. She's loosening herself here. And then in between the actual ribs and up in that line on the back that gets really tight. So if you can't reach, you can try and find a tool that's a bit longer. We were literally using a blush brush, but use what you have. This is another reflex hammer that we had that's longer, but you're just gonna be working up and down that area across the shoulder blade. All of this is gonna be really relieving. And then in between the ribs here, all the way around. You can lie on your back. And then grab onto your side and take some deep breaths and pump your liver down. So we often like to tell people to take binders after this. If you've never heard of a binder, we have a video coming up on that. But you do release some toxins when you release your liver.